It's Wednesday. Welcome to our Wednesday Wellness Tip. For today's psychological and emotional tip, I'd like to talk about the power of music therapy. So I was first introduced to music therapy in 1991, so about 31 years ago. And we first started using music therapy in the intensive care unit. We would use music therapy to help patients who were anxious and on a ventilator to try to relax their breathing so that they could wean from the ventilator easily. And what we found is that music therapy had a huge role in the clinical area to help instill relaxation, calmness, even to relax a person's breathing. So we would use music that had about 60 beats per minute or less to promote that relaxation. We used music that didn't have any words because we didn't want to trigger any memories or any thoughts that a person might view as negative. If any of you have had an AMA treatment in my office, you know that I use music therapy during all of my AMA sessions. So we've used music therapy a lot in the last 30 years. Now, it's awesome to see that it's being used more and more widely, even in the clinical areas. And even insurance companies are now covering music therapy. One of my colleagues, Dr. Alice Cash, she created a whole line of business to create CDs and tapes for people who are going to have surgery for them to listen to while they go under anesthesia and as they wake up in recovery. So many uses for music therapy. I was really thrilled to see this latest issue of the University of Louisville magazine because the University of Louisville Music School has taken music therapy to a whole new level. The director of the program, Lorna Segal, had this amazing idea to connect senior music therapy students with older folks in an assisted living facility. So she was able to work out an arrangement so the two students actually live full-time this year for their senior year in an older folks' home. And the results of this have been incredible because the students use their musical ability and talents and they entertain the older residents. And the older residents have come to just love these two girls. So they watch over them just like they're their own granddaughters. And the relationships that have been built between these two seniors and the older residents have just been extraordinary. So music therapy has opened up a whole new world for both the students and the residents. So I just thought that was an amazing idea. And I just think there's so many opportunities that we could combine different generations and really make a difference to bring younger people into the wisdom of older folks, and that both could benefit. So congratulations to University of Louisville on such an insightful program and a new way to use music therapy.